Good morning, dears. Today we are going to discuss about the exocrinal pancreatic insufficiency, particularly in micronutrient level. As you know, the deficiency of amylase, trypsin, chymotrypsin and lipase that affects the carbohydrate, protein and fat metabolism. Here, the defective absorption or malabsorption, when it affects the micronutrient level, particularly with the fat-soluble vitamins, say, in case of malabsorption of vitamin A, your patient will have the symptoms of or complaints of vision problems, like that night blindness, then dry eye, condition known as retinitis pigmentosa, and neurological symptoms like sudden fall on the ground or vertigo or giddiness, say ataxia. Then muscle weakness, etc. may be the symptom of your patient. When it affects the malabsorption of vitamin D, as you know, the defective absorption of vitamin D that leads to softening of bones or low bone density. So naturally your patient will have the symptom of osteoporosis or severe bone pain or osteoarthritis like symptoms. Along with vitamin D deficiency, magnesium also may not absorb properly. In such condition, the symptoms of claudications, twitching and jerking of muscles, etc. may be the symptom of your patient. Then regarding the defective absorption of vitamin K, when it affects the vitamin K, that directly affects the quality of your blood. In such condition, the patient may complains with easy bruising or skin rashes or dry skin or petechial like hemorrhages can be seen here and there, etc. may be the symptom of your patient. Then regarding the malabsorption of vitamin B12 or vitamin B complex in total, chronic oral ulcers may be the PC of your patient, and on evaluating, your patient may be usually in a condition known as macrocytic anemia. On general examination or on inspection of your patient, the look of your patient is very, very pathetic. That means your patient is very emaciated or weight loss out of proportion of his age or height, etc. That means your patient is very cachexic also, very weak, very depressed. Then regarding the chronic effect of such changes, when it affects the youngsters, maturation defect or delayed in pubertic changes has to be considered, because most of our patients presented with all symptoms are either neglected by the patient themselves or the neglection may be from medical profession. So only by a thorough, intelligent, very keen observation, the non-specific symptoms can be countered with a possibility of chronic pancreatitis. So these are the macro and micronutrient presentation of a patient with a chronic pancreatitis, and next about the endocrinal influence of chronic pancreatitis that can be dealt in next class. Thank you for watching.